Lung cancer can start in the windpipe, main airway or the lungs. It develops when there is uncontrolled growth of abnormal cells inside one or both lungs. These cells grow to form tumors. According to Institute Cancer Negara in 2019, lung, trachea and bronchus cancer is the second commonest cancer amongst males and fourth commonest cancers amongst females. Vaping devices are e-cigarettes, e-vaporizers, electronic nicotine delivery systems, and electronic non-nicotine delivery systems. Evolutions of vaping products started from first generations to fourth generations. Vaping and lung cancer. According to WHO, the evidence is clear that the aerosols of the majority of ants contain toxic chemicals, including nicotine and substances that can cause cancer.
These are the signs and symptoms for patients with lung cancer. Malaysian Ministry of Health declared that sale and use of electronic cigarette fall under Poison Act 1952 and Food Act 1983. Since nicotine was a Group C poison and only can be supplied by licensed pharmacies, based on the article that I have read, stated that 1% of adult smokers preferred vape that contain nicotine, while for the non-smoker, they tend to choose a flavored vape. Nicotine has tumor-inducing effects. Nicotine-derived nitrosamine ketone, NNK, is the conversion of nicotine, which is a carcinogenic material, that will influence the oxygen atomic addition to carcinogenic compound. Thus, it will improve the water solubility, resulting in the carcinogenic compound more easily to bind with oxygen and later will be converted into liquid by the enzyme. The cytochrome P450 acts as a cofactor with carcinogenic substance, forming electron deficient reaction and then bind with the DNA through covalent bond, resulting DNA adapt. The DNA adapt will interfere with DNA transcription, DNA replication and induce the mutation, which will lead to the formation of the cancerous cells. Next is cannabis or marijuana is a plant-based product that can potentially have an allergic effect and asthma control. Vape that contains cannabis have a high concentration of tetrahydrocannabinol (THC), which will bring an additive effect towards vape user. The regular vape consumption containing cannabis will lead to increasing respiratory symptoms such as dyspnea, dysphonia, pharyngitis, and asthma. Other than that, it also contains a low concentration of polycyclic aromatic hydrocarbon, which are carcinogenic compounds that will lead to respiratory epithelium damage.
Next content in vape is heavy metal. It can leach to the e-liquid when the heated metallic components make a contact with e-liquid at high temperature. Coarse particles include tin, silver, iron, aluminium and silicate, while nanoparticles dominated by tin, chromium and nickel. Nanoparticles tend to penetrate deep into respiratory system and can reach the alveolar sac, producing adverse effects to other organs such as liver, kidney, heart and brain. High air flow rate that is used to produce aerosol will enhance the deep penetration of nanoparticles into the respiratory system. Next, we move into the example of heavy metal. First, chromium that is generally affect the respiratory system and kidneys. Its long-term exposure can lead to lung cancer, and its inhalation has been associated with emphysema, chronic lung infection, and reduced lung function. Next, prolonged exposure of lead can cause vomiting, diarrhea, cardiovascular effect, and lung cancer. It is highly toxic when inhaled and is more readily absorbed into the bloodstream. Then, nickel, or also known as Group 1 carcinogen. Nickel inhalation can cause lung disease, damage to nasal cavity, lung irritation, lung inflammation, hyperplasia in pulmonary cells, and fibrosis. Overall, cancer risk was driven by high concentration value of nickel. The other examples of heavy metal are aluminium, which can accumulate in lung and lead to poor pulmonary function, cadmium, which known to cause renal toxicity and lung cancer, copper toxicity, which can cause lung toxicity, and manganese toxicity, which can cause impaired pulmonary function and pneumonia. To conclude about heavy metal, frequency of coil change is associated with greater metal concentration within aerosol, but not the tank. So it is preferred for people to use single-use device as it can be disposed after single use. Metals tend to accumulate in the body over time and give effect to the organs. And lastly, modification made to the devices only likely to worsen the risk of getting lung cancer.
Next is artemetol, which is a flavoring compound that presents in many vanilla and fruit flavor that induce inflammatory response and alter the local immune function. Diacetyl is linked to the interstitial lung illnesses that have potential to malignant transformation, and high exposure to diacetyl can cause bronchiolitis obliterans.
Propylene glycol is a carrier of vape solutions that provide the characteristic of smoke effects. Thermal decompositions of propylene glycol will generate a harmful carbonyl compounds such as aldehydes, including acetaldehyde, acrolein, and formaldehyde. Formaldehyde has been classified as a human carcinogen. It has been detected in the aerosol that are produced by vaping. Aerosol that contain formaldehyde highly associated with lung cancer, and the increased level of formaldehyde will cause lung disease and also can contribute to heart disease. The harmful carbonyl compound will cause increased oxidative stress, increasing cardiovascular risk, pro-inflammatory cytokines, platelet function alterations, airway epithelial injury, and DNA damage. Aldehydes will lead to lung cancer by oxidative stress that induce the formations of highly reactive endogenous aldehyde that react directly with DNA and forming DNA adducts. Aldehyde-induced DNA adducts will lead to DNA damage and promote carcinogenesis. Impaired DNA repair mechanism will lead to malignant transformations.
E-cigarette contain tetrahydrocannabinol, which have been shown to have high concentration of vitamin E acetate. High exposure of lung to vitamin E acetate may affect the physical structure of pulmonary surfactant. According to Callaghan, dysfunctional of pulmonary surfactant can lead to excess lipid accumulation within alveolar macrophages. This lipid accumulation in alveolar macrophage is called as lipid-laden macrophage. Another potential harmful effect of vitamin E acetate that may contribute to lung injury occurs when it is heated in e-cigarette products. According to Callaghan, chitin is a reactive compound that could contribute to development of chemical pneumonitis, which is also known as inflammation of lung or breathing difficulty in EVALI patients.
Introductions of harmful particles or pathogens will cause epithelial barrier dysfunction. This will increase epithelial permeability and susceptibility to infection as long as long-term inflammation. This will contribute to a number of chronic lung diseases.
Cytologic atopia could be associated with increased lung cancer risk due to the morphologic changes in bronchial epithelial cells that correlate with broad changes in the bronchial epithelium. Histologic changes include increased parenchymal tissue density, cellular infiltrates proximal to airway passage, alveolar refractions, increased collagen depositions, and bronchial thickening with elastin fiber disruption. In adenocarcinoma alveolar basal epithelial cells, exposure to e-liquids and e-vapor greatly elevated the expressions of EMT markers. Despite available insights from in vitro and in vivo data, yet no clinical study has been performed to analyze the effect of e-cigarettes on carcinogenesis in human subjects. This will require a longitudinal effort to establish a direct link or causality with the latency period of cancer formation.
For the prognosis, it is associated with e-cigarette or vaping product use associated lung injury, which is EVALI, with 2,807 patients have been hospitalized with 68 confirmed deaths. The most severe form of EVALI is acute respiratory distress syndrome. According to Smith ML, he stated that the disease can resolve completely. However, there are some consequences which are residual lung dysfunction and chronic pathologic sequelae that are linked to tobacco cigarette smoking. The outcome of the disease includes almost half of the patients with EVALI may require high amount of oxygen, about a half to two-thirds of hospitalized patients may require admission to the ICU, patients with EVALI may experience life-threatening hypoxemia, respiratory status of the patient may worsen up, and it can also be fatal. The complications include pneumothorax, pleural effusions, and pneumomediastinum. However, prognosis for those affected remain uncertain due to lack of long-term data and the fact that patients have died from EVALI, thus indicates that vaping does not directly cause lung cancer.